So here you are going to watch a hybrid coblation tonsillectomy in a 21-year-old girl. You can see she's got a lot of tonsilloliths and she gets recurrent tonsillitis as well. So you can see all these tonsilloliths coming out. So we are performing a hybrid tonsillectomy where we will do extracapsular tonsillectomy on the lower, in the upper pole and intracapsular on the lower pole. Now I am starting at the upper pole with coblation at the setting of 7 for ablation and 3 for coagulation. And I'm taking the incision right where the, now that was the marking, and now I'm taking the incision right at the point where tonsil is ending so that I get into the correct plane. And as you see here, that's the boundary of the tonsil. Here I'm going extracapsular, but I'm not injuring the muscles. Can you see this? The fascia is still very well preserved. Now I'll hold the tonsil and pull it medially and try to remain between the muscle and the lymphoid tissues. So I have not opened up the muscle spleen as yet. See, that's the plane of the tonsil. I'll remain very close to the tonsil. I'll try not to open the muscles at all, which is obviously not possible, but I'll try to minimize it. Now, this is the dissection of the upper pole. All right. Now, we'll proceed very close to the tonsils. But you see here, some amount of muscle exposure is inevitable because this is adult patient. Here the muscle is not exposed, here it is exposed. So this part will be painless, this part is bound to hurt a little. We'll try to minimize as much as possible. But as I said, it's not possible to completely escape the exposure of muscles in a extracapsular tonsillectomy. Because it is a case of recurrent tonsillitis, I want to remove the tonsils almost completely. Here, as I said, I'll remain very, very close to the tonsil and coagulate along the course of the vessels. Now, we have almost reached the lower pole. Can you see this? The tonsillar artery will come somewhere inside. So here I am going intracapsular. This is the lingual tonsil. This is the palatine tonsil. Here I am going intracapsular. That means I will not expose the tonsillar artery. I'll not open up the tonsillar artery. This is the lingual tonsil. And I'm coagulating on the tissue so that we open up the branches of the tonsillar artery, leave a very, very small bit of lymphoid tissue behind, which we are anyway ablating and coagulating the last bit. We are not leaving behind any significant amount of lymphoid tissue which can give trouble again. Can you see this is a very, very little amount of lymphoid tissue, less than a millimeter left behind, which is also coagulated, and this is the lingual tonsil, which again is coagulated. So again, not leaving behind too much of lymphoid tissue and coagulating the last bit. Can you see this? Just a little sliver of tissue on the lower pole to prevent opening up of the tonsillar artery, and this is the coagulation of the lymphoid tissue in the lingual tonsil area. So this is the hybrid tonsillectomy, which gives the advantage of a complete removal, but the bleeding part, which can happen from the tonsillar artery, as you can see here very clearly, that this last part, there is hardly a millimeter of lymphoid tissue which is left behind, but it is coagulated nicely so that it will fibrose and will not give trouble again. This provides a cover for the tonsillar artery. Alright, so that's hybrid coblation tonsillectomy for you. Thank you for watching.